Well, good morning, Miramar. We are back in business. I'm your host, Tamara G, and this has been a wild 3.5 months, but we are so happy to be back this July morning. And with me this morning, as you can tell, we are social distancing because that's what we're supposed to be doing. We have Dr. Tadra Anderson Rhodes. She is the Chief Medical Officer for Memorial Hospital Miramar. There you go, Memorial Hospital Miramar. And the reason why we started with the mask is that Dr. Tadra is going to show us how to properly take off our masks. We're going to be talking with her about the latest coronavirus numbers and much more. And Dr. Tadra, the reason why we wanted you here is because this has been, people thought this was only going to last like a week or two.
Absolutely.
This has been more than 3 months, going on 4 months of people social distancing, wearing masks, getting the virus, living through the virus. Unfortunately, some have passed away from the virus. So we're just doing a whole checkup on where we are right now in July. So how are you?
Well, thank you, Tamara. I am doing well, and good morning to your viewers. It is really good to be back.
Yes.
And back here in the studio to share some really important medical news.
Okay.
And some things that I think will help our community to stay safe. So first up, because we are wearing our mask, and I am actually doubly masked.
Okay.
We want to make sure that while we are masking, that we also know how to take our masks off properly, because there is a correct way to do that.
And who knew?
I know. So if you've been out and about, you really don't want to touch the front of your mask, because that's where, if there are germs, they have collected.
Okay.
So you really want to come from behind,
Okay.
grab your mask from behind, so that you're not touching the
Gotcha.
front of the mask,
Gotcha.
and then you can remove it
Wow.
that way and not have touched the front of the mask, okay?
Awesome.
And then if you have a cloth mask, like
Okay.
yours is there, you have Texas, I have Duke.
Repping
then
our alma maters.
these should be cleaned daily, okay? And
Really?
if the mask is soiled, so you always want to keep an extra one with you.
Okay.
If the mask is visibly soiled, you want to remove it right away.
Okay.
And have your secondary mask. So we have several types here
Okay.
that I have here for display.
Okay.
But then you'd want to change that mask right away.
Okay.
We are asking that the community not wear the surgical mask, because this is very valuable PPE. I'm wearing it obviously because I've been in the hospital all day. But we are asking the community, if they can, to use the cloth mask and to reserve that precious PPE for those who would work in the hospital.
Okay.
And then when you put your mask aside,
Gotcha.
you want to make sure that you're, again, not touching the front,
Okay.
and lay it to the side or take it directly to the wash.
Okay.
Okay?
And so these can be washed every day, is what you're
They
suggesting?
should be washed every day, and
Okay.
if they're visibly soiled, they should be washed right away.
Okay.
The other key thing while we're on mask is to make sure that the masks fit properly. There's actually a proper way to fit the mask.
Who knew?
So the mask must cover the nose,
Okay.
and it must cover the mouth fully.
Okay.
It's recommended it should come just underneath the chin,
Gotcha.
and there really should be no gaps around the mask. So
Okay.
this one fits really well. Yours fits really well. There are some that have adjustable straps to
Okay.
help, especially with the little ones,
Okay.
because they're not one size fits all. But there are also others that don't fit as well. They might be cute, but if there are gaps, so
Okay.
this one is a little bit too big. It's small this way, so you
Right.
have to actually open it out. But I'll show you what I'm talking about. This one doesn't cover the chin like this,
Okay.
so it has to be pulled down properly and over the nose. Once I fit it, I shouldn't have to touch it. If I'm having to touch it, you see it's drooping a little bit,
Yeah.
it's too big, and there are gaps.
I see
So
it.
if there are gaps, then I'm not protecting you as much as I would be if the masks were fitted properly.
Okay.
Remember, we are recommending masks because we're preventing source control. So when I wear my mask, I'm protecting you. When you wear your mask, you're protecting me. When we're both wearing our masks, we're doing the socially responsible thing and protecting one another in our community.
So just a little side note here. I've been wearing masks for years on planes.
Okay.
And my radio partner, Julie Guy, I'm just going to put her out there. She used to make fun of me so much. She would say, "Why are you looking like a crazy person getting on the plane with a mask?" And I used to tell her all the time, well, I don't want to get sick. And I used to get sick every time I was on a plane. I'd come off, I'd have the sniffles or whatever. And so I I've been wearing masks for years. Now everybody's
Now,
wearing it.
and you can have your own private, mask. You can have someone
Collection.
make it your collection.
Exactly.
I like to be accessorized, so
Uh-huh,
I have
exactly.
found it to be quite well. But you're correct. Wearing masks does really help. But again, it really is more to protect others from you.
Right.
Other things though that help, especially on a plane or even here, you'll notice I have some show and tell is hand sanitizer, because we can't always have a sink to wash our hands. Hand washing is best.
Yes.
20 seconds with warm water and soap, but when that's not available, hand sanitizer is the next best thing. It should be at least 60% alcohol. So like here I have one that's 80%. This one's 62%.
That's gold right there.
Gold,
Okay.
yes. But you want to keep it in your pocket, in your purse,
Okay.
especially if your kids are going to school or other activities. Should school be back open? But it's always good to just, give a rub, and you want to make sure that you continue rubbing until the hand sanitizer is dry. A lot of times what we see is people will hand sanitize and then keep it moving. You do need to continue to rub to allow it to get in there and do its job until it's actually dry.
So, Dr. Tadra, we've talked about wearing masks, the proper way to take them off, hand sanitizer. These were things, as a physician for many years, shouldn't people know these things already? Shouldn't you know to wash your hands regularly? Shouldn't you know once you use the restroom, you walk,
Well, Tamara, I'm glad you mentioned that. So at Memorial, we're going to sort of a back to basics campaign.
Okay.
You are correct. Now, we're in healthcare, and yet we still have to remind our workers and visitors to do this even before COVID. So we've just, dusted off a few things and said we've got to get back to basics. Hand washing, you're correct. It's something that we learned as children back in the day.
I've been doing this since I was 3.
Yes, but sometimes we forget. So we want to be mindful that those are the socially responsible things, but also it helps to protect you. Because like we have this surface here, which I'm sure, because we were told it's cleaned properly.
Thank you, Andy.
And has been sanitized and
Yes.
disinfected. But this is where germs can actually lie,
Okay.
and viral germs especially. So COVID is a virus. It's a specific coronavirus. There are several types. The one type causes like the common cold, but this one, the SARS-CoV-2, which is so virulent, it can last for a while on surfaces. So you want to continue to also just be aware of your surroundings. Mom used to say, don't touch that, don't touch this, and she was right. So we want to make sure that, keep your hands in your lap, try not to touch other surfaces, but sometimes that's not possible. Like you're here working.
Right.
So hand sanitizer is sort of the next best thing after the other cleaning and sanitizing and disinfecting.
Okay. Well, we've been talking about COVID-19 and what it has done to our country as a whole. Miami-Dade County just implemented some new shutdowns. I'm sure Broward County is going to be following suit. Yes, because the numbers have spiked again.
Yes.
So tell us a little bit about that, and particularly numbers that you received earlier this week.
Okay. Well, Tamara, it's really almost frightening to think about the numbers. They are exponentially rising, and by that I mean just so quickly. If you look on any of the curves, it's not a linear. It swoops up and slopes up quite dramatically.
Okay.
So the latest numbers that we have for the state of Florida, 213,794 folks are positive, and that's about a 9.5% positivity rate for all who have been tested.
Okay.
That's up over 7,000 cases from yesterday's numbers. So they continue to actually grow, which is what's alarming.
Okay.
Here in Broward County, 22,595 cases with about 2,317 hospitalizations, 2,317, which is about 10 to 11% of those who are positive who are being admitted to Broward hospitals. That's higher than what we saw initially during the COVID surge and this COVID crisis. Miami-Dade County, though, is now double us. And the reason I like to point out Miami-Dade County, even though we're Broward, we sit here at Miramar right on the county line.
Absolutely.
And so Miami-Dade County now is over 51,000 cases.
Wow.
And with, that's just growing daily. And so we just want everyone to be mindful. We don't want people to be frightened by the numbers, but we do want them to have a healthy alarm about those numbers.
Right.
Specific to Miramar, and we have several zip codes, Here in 33029, we have 403 is the latest number of cases.
Okay.
As you move from this westernmost part of Miramar east, the numbers are rising. So 33027, 621 cases. 33025, which includes Miramar, 1,082 cases.
Okay, that's
Moving
like central.
further east, 33023, 1,223 cases. And so it continues to grow and grow as you move west to east. Additionally, once you get to the central part of the state, moving further south into that North Dade corridor is definitely considered a hot spot.
So that would be the Miami Gardens,
Miami
the
Gardens,
Miami Lakes.
Miami Lakes, Hialeah areas. So we want everybody just to really be mindful of their surroundings, because there are some things that you can do. We know that there's really no best treatment right now except to avoid being exposed altogether.
Okay.
So we need our viewers to pay particular attention to their surroundings. At Memorial, as part of our Back to Basics campaign, we're asking everyone to commit to their safety, but commit to the community safety. The ways that we can do that, exactly, avoiding crowds. So what that means is really no gatherings more than 10 people, and really those should be people that you're familiar with in your own family. If you need to be around people outside of your own family, no more than 10.
So no more graduation parties, no more baby showers, no
not
more.
unless it's the drive-by kind and you have your mask on.
Okay.
So even if you're in those types of situations, everyone should still be having on their masks.
Okay.
And then also when you're in those spaces, you do need to have that physical distance. So at least 6 feet apart. And that 6 feet, yes, love our memorial signs. That 6 feet is at least about 2 arms lengths away. So we are good here. Even though we could be better, we know we're doing this for our viewers, but we want to make sure that people are that distance. And even if they're that distance, to still wear the mask. Again, we're trying to contain the virus if someone should have it, and not just coronavirus, but really all viruses. Right? So we want to make sure that they commit to that. We also want to make sure, as we talked about earlier, that they cover their nose and their mouth. So I can't tell you how many times, and my staff will tell you, I've really become the mask police. But you have to wear it correctly. It doesn't work. Because if people aren't covering their nose and they sneeze
or cough,
then those droplets can then carry the virus. They can then be inhaled by you or me or by others. Or they could actually get into your eyes or your nose or your mouth and then infect you. And the problem is that most people don't even feel sick before they're infected with COVID virus. So you can't look at someone and say, oh, they do or they don't. So that's why everyone needs to properly wear the mask and then also keep the mask washed. And then the last thing that I will say in terms of what we're asking people to do is, again, cleaning their hands regularly and cleaning surfaces regularly. And so on the CDC website, they actually have really great tips for diluted bleach solutions that can be used to disinfect. We always want everybody to clean first with like a regular detergent or soap and water, but then you can actually disinfect with a diluted bleach solution, or you can check on their website to see if the products that you use will actually kill the virus itself. So there's lots of ways that we can keep ourselves and our community safe.
And we'll get to that disinfectant in just a minute. In case you are just tuning in to Good Morning Miramar, we're here with Dr. Tadra Anderson-Rhodes. She is the Chief Medical Officer for Memorial Regional Miramar and a frequent guest to our show and friend of the city. And we wanted to talk about that disinfectant too, because so many people now are running to the stores and trying to find it. They can't find it. So now you have a panic because people can't find it. What can you tell those folks, or what can they do? I guess the CDC has some ideas for them to still stay safe.
Exactly. And also some of the products that people are finding are very expensive, which is unfortunate. So good old-fashioned bleach still works. But it does need to be diluted. So there are specific recommendations on the CDC website. It's usually about 1/3 of a cup of bleach to a gallon. And so they're very specific. They'll even break it down if you don't have a gallon, you have quarts, but it's right on there. The other thing that I would be mindful of is that some of the products that we're running around trying to find may not even be on the list as a good product. So there is a little link for an EPA link where you can actually click on it, enter your product's EPA number,
Okay.
and check if it is okay.
Okay, perfect. And now we also get all of the I like to call them witch doctors, people who come and say, oh, I've got this great disinfectant, or I've got this great thing that will kill all viruses, but really that hasn't been tested. So do we even trust those people with what they're trying to sell us? Because that's what they're trying to do, is sell you something.
Exactly. Still, bleach is still the least expensive and one of the most efficient ways to disinfect. Again, that's not surface cleaning, but to really disinfect. And that's an easy find in terms of bleach.
I've actually seen it
everywhere.
Yeah, it's back in stock.
It's back in stock, so I'm recommending that everyone gets it. And it's also a good idea to have that for hurricane season.
Right.
So it's dual purpose right now, so it makes sense for folks to get it. And again, right on the CDC website, if you just Google disinfectants, it'll tell you how many parts bleach to how much part water. It does have to be room temperature water. It gives you specifics like that, and that's a nominal cost compared to what you get out of it.
That's perfect. And I know we talked earlier, and this was off mic, about the things that people are social butterflies who are having to be caged at home, and not being out. But truly, it's for their own good, right? Because I saw some pictures from the 4th of July weekend. I don't ever want to see that again, because people lost their minds. They were crowded next to each other on the beach. So in other words, I know the numbers are going to spike in a few weeks. They're going to spike. These people were all over each other. They didn't know each other. They're just no mask.
Right.
What do we say to those people who are just having that anxiety about, I can't get out, I can't be around people, but I want to.
I want to be. I would say that this is really not a matter of freedom. It's really a matter of public health. Theirs, yours, mine, everyone's. And so when you think about the sacrifice that you might have to make now for the liberties that we hopefully all will get to experience in the future. Again, I think it makes sense to frame it like that. What we really have to do, particularly with young people, because they are so tech savvy, we have to leverage that technology with them and for them. So where we used to try to limit that, in some households, I think that now with certain social platforms, whether it's Zoom or Blackboard Collaborate or Instagram, the TikTok things, which are so cute, that we have to find ways to incorporate technology so that kids will understand this is their new normal for now. But if we all do our part, and I shouldn't just say kids, really it's adults as well, but if we all do our parts now, we will be better for it later. Because what we want to be able to do, and we showed early on, is we really did flatten our curve. But once people's anxieties, as you said, probably kicked in, and the freedom they felt to go out, I think we didn't exercise some of the best judgment. So we're asking people to really have better judgment. And those are, as we've talked about, a few things that they can do. But just to remind you, avoid your crowds, cover your mouth and your nose, and wear your masks properly. We want to make sure that you keep your hands clean. So soap and water, but hand sanitizer for those who can't be right at the sink to wash right away. And then make sure that you're cleaning your surfaces as well. The additional thing that I will say is that we can also check for symptoms ourselves. So while some of the symptoms tend to be subtle, or some people have no symptoms at all, when people do have symptoms, we want to make sure they're aware of what those may be and that they call their doctor. So fevers, difficulty breathing, runny nose. One of the things that actually sets this virus apart is that we find that patients who are affected tend to have a new sense or loss of sense of smell or taste. So that's very different for this virus than what we've seen with other viruses. So those are some of the signs and symptoms. Again, people may not have symptoms at all.
We just found out that Atlanta Mayor Keisha Lance Bottoms.
No symptoms whatsoever. So we are, though, now doing increased testing that is available. Mayor Messam and the City of Miramar are doing testing with Memorial Healthcare System out in the central to east side of town at the Youth Enrichment Center. And that's daily from 9 a.m. to 2 p.m. until the test lasts for the day.
Okay.
But also at CB Smith Park, and there are other sites around. So we are recommending that even if you're not symptomatic, you can get tested, because we'll get a better handle on this disease and the disease process when we know what the prevalence is really in the community, and we can see where there are hot spots or pockets and really do some contact tracing to see how can we minimize or contain.
There's science again coming
Yeah.
into play. Isn't that great? So
Yes.
we want to end, Dr. Tadra, with, I know we've talked about numbers, we've talked about, the infection rate in the state, in Broward, and also Miramar. But we also want to let people know that people do survive COVID. This
They
is
do.
not a death sentence if you do
Right.
get it. Because
Right.
a lot of people think that, oh my gosh, if I get it, I'm a goner.
Yes. Well, what's unfortunate is that it's still really new in terms of our understanding of COVID. But you're correct. There is a high survivability rate. Unfortunately, there are some high-risk groups. So persons who are obese,
Okay.
BMI greater than 30, persons who have significant medical problems, so hypertension, cardiovascular disease, heart disease, some lung issues, those persons are at higher risk. And again, the best way to survive it is to avoid it altogether. Having said that, it does affect different people differently. And so we're just continuing to monitor. We're learning day by day. What we have seen, particularly in the state of Florida and Broward County in particular, the age of those affected is getting lower and lower. So at the height of our first surge, the average age of those who were hospitalized about 49, now it's 40.
Okay.
And it's continuing to fall, but that doesn't mean that the mortality rate has changed that much, but we're continuing to monitor. So those who have significant medical problems are the ones that we want to protect the most. So I implore everyone who has family members in some of those high-risk categories, please do your part to keep your loved ones safe as well, because that's also part of our social family community responsibility. And I can't say it enough, the best way to avoid some of these bad outcomes is not to get the virus at all. Having said that, if you suspect you have COVID-19, it's imperative that you contact your physician, get direction from your healthcare professional about where to go for testing. And then when you're sick, if you're not sick enough to be in the hospital, you really need to quarantine at home. And isolation at home is important, because even if you have loved ones in the house with you, you need to be able to separate yourself. You need to be able to follow the CDC guidelines in terms of how to keep your area safe and their area safe,
Okay.
and things like that. So the good news is there's a wealth of information that's available to all of our fingertips, because most people have access to computers
Or smartphones.
to be able to get the information. It's so critical, though, that Tamara, the information changes sometimes daily. Just as I said, the numbers change. So what we're learning, medications that we thought early on could be useful that are now not thought to
They're
be
obsolete.
useful. They're obsolete.
Okay.
Other medications that we know might be helpful but may be on shortage. Other things that people can do, like who have been affected, who can then donate their plasma. Convalescent plasma has been shown to be very promising.
Okay.
So for those who survive, they can do another thing for the greater good of our community, which is to donate through One Blood. That's who Memorial Healthcare System uses. And that treatment, which is under study, and under the auspices of our research team, and we do have a director, Dr. Candy Sorelli, and our chief medical officer for the system, Dr. Stan Marks. That team is working diligently to be able to provide that treatment option for patients who do need it. So, but it's rapidly changing. I can't also say enough that we all need to stay informed, and we need to stay connected. Now's the time, because communications are happening. There may be days from our communications folks that we may get 4 or 5 things that have changed in one day. So what we knew at 9 a.m. might be obsolete by 5 p.m.
Wow.
And so it's really important for right now for the community to stay connected and to really make sure that they have valuable information, but also the correct information. So not all information is the same, right? So we recommend that people go to a very reputable site. Our healthcare system on our website page, we do have information.
That's MHS.net, right?
.net,
Okay, MHS.net.
And the CDC has CDC.gov. Anything you want to know, whether it's for pregnant women, for elderly, for people in nursing homes, for going back to work, for travel, what to do if you're traveling, and some people have to travel, whether it's for work or for other reasons.
Right.
Things that you could take in your car, things that you can do to minimize your risk. So now's the time to really stay connected because things are changing so rapidly. Memorial, we're very grateful for them to be able to have a platform. They are providing webinars and seminars and information sessions, not just for doctors and nurses and staff, but also for the community. Our physicians are online providing information. It's really easy to be able to get that information from our website. But we're here with the community. We're in this for the community. We're in this really to win it. And we know that with the community's help in the future that we're going to do just that.
COVID-19, you're going to be out of here. You're going to be out of here. So, and speaking of, we're going to have you back. I know we're going to have you back in about a month or so to give us some more information and to definitely keep us up to date on where we are with this disease. But we definitely want you all to be informed. So again, that information, you can always go on Memorial's website. That's MHS.net. Or you can go to cdc.gov, the Centers for Disease Control. You can always, of course, go to our website, MiramarFL.gov. We want to thank you so much, Dr. Tadra Anderson Rhodes, for being here. She, of course, is the Chief Medical Officer for Memorial Hospital Miramar, a great friend of the show, and we will have you back. You already know you're coming back, so love you much.
Thank you.
You're welcome. And thank you so much for watching. Until next time, good morning, Miramar.